Good morning, student. This is Rohit Pal, Assistant Professor at Doon Valley Institute of Pharmacy and Medicine. Today, we are going to start with anti-leprotic drugs. Before starting with anti-leprotic drug, we should have little knowledge about leprosy. What are the risk factors associated with leprosy? Which bacteria is responsible for causing leprosy, and what are the diagnostic tests that are used to detect leprosy? Leprosy is also known as Hansen disease. It is caused by Mycobacterium leprae. It is a rod-shaped bacilli and obligated intercellulary, means it grows inside human body or animal cells. It is a gram-positive bacteria. It is also termed as acid-fast bacterium. It is stained with Ziehl-Neelsen stain. It contains mycolic acid, and because of mycolic acid present in its cell wall, it stains red on a blue background. It is genetically similar to Mycobacterium tuberculosis, and this bacteria is responsible for causing tuberculosis. Next, risk factor for leprosy. People at highest risk are those who live in area where epilepsy is endemic. Part of India, China, Japan, Nepal, Egypt, and other areas. There are some evidence that genetic defect in immune system may cause certain people to more likely to become infected. The region in which genetic defect can occur is Q25 on chromosome 6, and people who handle animals are also susceptible to leprosy. For example, African chimpanzee. Next, mode of transmission. Leprosy is transmitted from human to human or animal to human. Droplet and other secretions that contain bacteria can cause leprosy. Disease spread from person to person. When someone with disease cough or sneeze, these droplets release into air and other people can inhale them. Next, type of leprosy. Leprosy is mainly of three types: tuberculoid, lepromatous, and borderline. Tuberculoid is less severe as compared to lepromatous, and people with tuberculoid leprosy get patch of flat pale yellow colored skin, whereas in case of lepromatous it is more severe and widespread skin bumps are formed. It is more contagious as compared to tuberculoid, whereas borderline leprosy have both tuberculoid and lepromatous symptoms. Next come diagnostic test for leprosy. Skin biopsy. In this, a small sample from abnormal skin is taken and examined under microscope. Skin smear. In this, skin fluid is taken and smear is prepared and tested for Mycobacterium leprae. Now here come anti-leprosy drug. This is the main topic. So basically anti-leprosy drug होते क्या हैं? Antileprotic drugs are that drugs which interfere with the growth or the proliferation of bacterium which is responsible for leprosy. Now, next is the classification of anti-leprosy drug. So, first class is sulfone, in which dapsone is a drug. It is a primary antileprotic drug. Then, phenazine, clofazimine is a drug. Antibiotics, minocycline, ofloxacin, anti-TB drugs are used to or are also used for the treatment of leprosy. Rifampin, ethonamide, these are the drugs that can be used to treat leprosy. Dapsone is a major drug that is used for the treatment of leprosy. Dapsone is most widely used drug for long-term treatment of leprosy. Although sulfones are highly effective against most strain of Mycobacterium leprae, a small number of molecules, especially those found in lepromatous leprosy patients, are less susceptible and can persist for many years, resulting in relapse. Before introduction of current multi-drug regimen, resistance rates were as high as 20% with dapsone monotherapy. So, mostly drugs that are used, they contain combination therapy. So, dapsone is chemically diamino phenyl derivative in which sulfone groups attached these two diamino ring. It is a white or creamy white crystalline powder. It is slightly soluble in water. It decolorized on exposure to light, but this is not accompanied by significant of decomposition. It can be used in the form of injection and tablet. It acts in a similar way as sulfonamide are act. It is a competitive inhibitor of PABA, that is para-aminobenzoic acid. It inhibits synthesis of folic acid. Sulfones are bacteriostatic and used for the treatment of leprosy. Dapsone, Dapsone combined with other antileprotic drugs such as rifampin, clofazimine and used for the treatment of leprosy. Next drug is the phenazine dye. Phenazine is a weak bactericidal agent. It comes in red color dye. It acts against Mycobacterium leprae. It is not a primary drug when talk about treatment of leprosy. It is given to the patient which are resistant to sulfones. Chemically, it contains phenazine moiety. It acts by binding with mycobacterial DNA and interfere its template function. It also increases generation of reactive oxidant from neutrophils and exert anti-inflammatory action. Uses: it is used for the treatment of leprosy. It is also used in the treatment of multi-drug therapy of tuberculosis. Thank you.